Kidney health is one of the most underestimated concerns among seniors in the United States, yet it directly affects the quality of life, independence, and longevity. Every year, tens of thousands of older adults in the United States, Canada, the United Kingdom, and Australia are diagnosed with some form of chronic kidney disease without realizing how much their lifestyle and daily choices influence the decline. Many only learn about it when it's already at stage 3 or worse, often requiring dialysis or even transplants. While medication can slow progression, supportive nutrition plays a massive role, and one of the easiest but most overlooked methods to protect kidney health is tea. Yes, certain herbal teas offer kidney supportive benefits that are powerful, natural, and safe for seniors. Dandelion root tea is an ancient remedy that still hasn't gotten the attention it deserves in modern healthcare circles, even in the United States, where natural medicine has started to gain more popularity. It works as a gentle diuretic, helping the kidneys flush out excess sodium, water, and toxins without the harsh effects of pharmaceutical diuretics. People dealing with water retention and swollen ankles often report major improvements just by adding 1 or 2 cups of dandelion root tea into their routine. Unlike chemical diuretics that can cause electrolyte imbalances, dandelion root contains potassium, which supports fluid balance and protects against dangerous drops in mineral levels. Seniors especially need this balance to avoid complications like dizziness, cramping, and low energy. It's used widely in Canada and the UK by naturopaths who prioritize gentle detoxification methods, especially for patients with mild kidney stress. Nettle leaf tea is another powerful kidney-friendly tea that has gained clinical attention. In traditional practices in the United Kingdom, and also increasingly in parts of the United States, it has been used for decades to support urinary tract function and reduce inflammation in the kidneys. The kidneys are highly sensitive to inflammation, and many seniors with high blood pressure or diabetes develop low-grade chronic inflammation in their kidneys without knowing it. Nettle helps soothe the urinary tract and encourages the removal of uric acid, a compound that, if not properly excreted, contributes to gout and kidney stones. In older adults, uric acid buildup can silently damage nephrons, the filtering units, in the kidneys. Drinking nettle tea a few times per week has shown benefits in reducing markers of inflammation and increasing urine volume, which helps the kidneys stay active and healthy. Many seniors in the United States have even reported fewer flare-ups of gout after consistently drinking nettle tea combined with lifestyle changes. Hibiscus tea is incredibly rich in antioxidants, especially anthocyanins, which have a direct role in reducing oxidative stress in the kidneys. This is critical because kidney tissues are particularly vulnerable to oxidative damage, especially in seniors who have been on medications for blood pressure or diabetes for years. In the US, chronic use of certain drugs like NSAIDs and even some blood pressure medications can accelerate kidney aging. Hibiscus tea, known for its bright red color and tart flavor, offers a protective effect by fighting free radicals. It has also been shown in several clinical studies, including ones done in the United States and Canada, to lower blood pressure naturally. High blood pressure is the second leading cause of kidney failure in America, right after diabetes. This tea supports both heart and kidney health and is often recommended by holistic practitioners for seniors who want to avoid or reduce their reliance on synthetic medications. But one must be cautious. Hibiscus can lower blood pressure significantly, so it's important for seniors already on antihypertensive meds to monitor their readings closely. Corn silk tea may sound strange to some in the United States, but it has been used for generations in rural parts of the South and is a time-tested kidney remedy. Corn silk, the fine strands you peel away from corn husks, is rich in flavonoids and antioxidants that promote urinary tract health. It has mild diuretic properties that help flush the kidneys without draining essential electrolytes. Seniors who struggle with frequent UTIs, bladder infections, or slow urination often find relief after incorporating corn silk tea into their daily regimen. It gently supports the urinary tract lining and reduces irritation, which is crucial for older adults who may not respond well to repeated courses of antibiotics. In parts of Canada, traditional medicine practitioners regularly use corn silk for clients with early-stage kidney concerns, and many seniors report a more comfortable and regular urinary flow after just a few weeks of consistent use. Goldenrod. Tea is often misunderstood in the United States because it's sometimes confused with ragweed, but it's completely different and does not trigger allergies in the way people often assume. Used in Native American medicine and still respected in herbal circles across the United States and Canada, goldenrod is a natural anti-inflammatory and antimicrobial herb that specifically benefits kidney and bladder function. It helps flush bacteria from the urinary tract and reduces kidney congestion. This is critical for seniors who suffer from chronic cystitis, recurring UTIs, or who take medications that put extra load on the kidneys. In elderly individuals, kidney infections can turn serious quickly and often lead to hospitalizations. Goldenrod tea helps reduce the frequency of such episodes and supports immune function in the urinary tract. In elderly patients from Australia who used goldenrod as part of a broader kidney wellness program, urinary urgency and discomfort were reduced dramatically, according to some integrative medicine clinics. Many seniors in the United Kingdom who prefer herbal remedies over pharmaceuticals turn to goldenrod to stay off antibiotics for as long as possible. Parsley tea may surprise some people, especially in the United States, where it's often just seen as a garnish, but parsley contains potent compounds like apigenin and myristicin that directly stimulate kidney activity. It increases urine production, supports detoxification, and helps expel excess salt, a serious issue in senior diets. Loaded with processed foods, even among older adults who believe they eat healthy, hidden sodium in packaged and canned foods, often contributes to blood pressure issues and kidney strain. Parsley tea acts as a mild but efficient cleanser. Elderly patients with a history of kidney stones sometimes turn to parsley because it helps prevent stone formation by reducing calcium and oxalate buildup in the kidneys. In clinical experiences from healthcare providers in both Canada and the United Kingdom, parsley tea is often used as a preventive measure for those at risk of stone recurrence. Seniors who are looking for safe, natural ways to stay off heavy diuretics are finding parsley tea an affordable and easy option, especially when they grow it at home or buy it fresh from local markets. Bearberry leaf, also known as Uva ursi, is another powerful tea ingredient that targets urinary tract health and kidney filtration. It contains arbutin, which converts into hydroquinone in the body, a natural antibacterial compound. This is especially relevant for seniors who face recurring urinary infections that damage kidney tissue over time. In the United States, it is used by holistic urologists to assist patients who want to support urinary health without relying entirely on antibiotics. However, it needs to be used under guidance, since extended use can stress the liver. But for short-term support, especially when combined with other herbal teas like nettle or corn silk, it offers profound relief. Many elderly individuals in Australia have used Uva ursi in rotating herbal routines and experienced fewer infections and clearer urine flow. Some even report lower levels of discomfort during urination and better energy levels, since kidney overload can often lead to fatigue. Marshmallow root tea has a soothing, mucilaginous quality that can ease inflammation in the urinary tract lining and promote healing in delicate kidney tissues. This becomes critical for seniors who already have thinning tissue integrity due to age, medications, or chronic infections. In parts of the United Kingdom, marshmallow root has been used historically, as a primary support for people with irritated bladders or kidneys. Seniors who experience burning, urgency, or even nighttime urination find that marshmallow tea helps them sleep more comfortably. It coats the mucous membranes and reduces irritation without acting as a harsh diuretic. In the United States, more herbal clinics are recommending marshmallow tea, especially for seniors post-antibiotic treatment, to help rebuild urinary tract resilience. Cranberry tea is often misunderstood in the United States because most people associate cranberries only with sugary juice or Thanksgiving dinners, not realizing how powerful this fruit actually is in its raw, unsweetened form. When used as a tea, cranberry delivers proanthocyanidins, compounds that help prevent harmful bacteria like E. coli from adhering to the lining of the urinary tract and kidneys. This is especially important for seniors who are more prone to urinary tract infections due to weakened immune response or catheter use in some cases. UTIs can silently travel up the urinary tract into the kidneys and lead to severe infections or sepsis in older adults, something too many families in the United States have learned the hard way. Drinking cranberry tea daily has been shown to reduce UTI recurrence in elderly women and men who previously struggled with back-to-back infections. In Canada and Australia, clinical nutritionists often include cranberry tea in their kidney detox plans, but it's crucial to choose varieties that are free of sugar and additives. Some seniors in assisted living communities have even started cranberry tea routines as a communal ritual, with some claiming their urinary discomfort and frequency issues significantly improved after just a few weeks. Ginger root tea brings benefits that go far beyond just soothing nausea or aiding digestion. For aging kidneys, ginger's potent anti-inflammatory and antioxidant properties help reduce systemic inflammation, a factor that directly impacts kidney degeneration in older adults. Chronic inflammation is often invisible, yet it quietly contributes to the slow loss of kidney function that millions of Americans face without a clear explanation from their doctors. In the United Kingdom and Australia, ginger tea is being used, more often among seniors with diabetic kidney disease, to combat the oxidative stress caused by unstable blood sugar. Seniors in the United States who suffer from fatigue, swelling, or frequent urination without explanation might actually be experiencing subtle kidney distress. And ginger helps by supporting circulation and flushing metabolic waste through the kidneys more efficiently. Some long-term care facilities in the U.S. have incorporated ginger root infusions into their weekly wellness routines, especially for patients recovering from long-term medication use or antibiotics. Ginger is also known to help reduce proteinuria, a condition where protein leaks into the urine due to kidney filter damage. This symptom is more common than people realize and is often dismissed until the damage is advanced. Turmeric tea, known for its main active ingredient curcumin, has emerged as a powerful tool in the fight against kidney inflammation. In older adults, especially those in the United States with diabetes, arthritis, or autoimmune issues, turmeric helps by lowering inflammatory markers that accelerate kidney tissue scarring. Clinical studies in both Canada and the United Kingdom have shown turmeric's ability to reduce oxidative damage in kidney tissues while also protecting against fibrosis, a condition where healthy kidney tissue is gradually replaced with non-functioning scar tissue. Seniors who are dealing with polycystic kidney disease, glomerulonephritis, or even stage 2 chronic kidney disease may benefit from turmeric tea as part of an anti-inflammatory diet. The emotional weight of these diseases is heavy, many elderly. Americans talk about the constant fear of dialysis, the loss of independence, and the crushing financial burden. While turmeric won't cure these conditions, it offers real, measurable support that may slow their progression. Turmeric tea should always be consumed with a small amount of healthy fat, such as coconut milk, or a few drops of olive oil and black pepper to enhance curcumin absorption. Seniors in Australia who use turmeric tea often report not just physical relief, but also emotional comfort, knowing they are actively participating in their own healing rather than just waiting for symptoms to worsen. Peppermint tea is often overlooked for kidney support, but it deserves attention for its ability to reduce discomfort, bloating, and kidney-related pain in seniors who suffer from sluggish digestion or water retention. When kidneys are not working optimally, waste can accumulate and trigger abdominal pressure, swelling, and general malaise. Peppermint tea supports the gastrointestinal system, helps relieve gas, and also mildly stimulates urinary output, easing the kidney's workload. In long-term care facilities across the United States, peppermint tea is often given after heavy meals to aid digestion, but more practitioners are now recommending it to support those with early-stage kidney stress. Seniors who feel constant pressure in the lower back or abdomen often report relief with peppermint's antispasmodic effects. In Canada, some naturopathic doctors are combining peppermint with marshmallow root and corn silk for seniors with irritable bladder or interstitial cystitis, a painful condition that can wear down kidney resilience over time. The cooling and calming effects of peppermint tea are also emotionally grounding, especially for elderly individuals who feel anxious about their health or upcoming lab results. Another underrated tea for kidney support is rooibos tea, which comes from South Africa, but is widely consumed in the United States, United Kingdom, and Australia. It contains no caffeine, making it ideal for seniors who are sensitive to stimulants that can stress the kidneys and raise blood pressure. Rooibos is high in antioxidants, including aspalathin, which has been shown to reduce inflammation and oxidative stress across multiple organ systems. This becomes vital for elderly individuals on multiple medications, which often produce metabolic waste that the kidneys are forced to process. In the U.S., where polypharmacy is common among seniors, rooibos tea offers a gentler alternative to coffee or soda and can be consumed throughout the day without any stimulant side effects. Some seniors also report that their sleep improves with rooibos, which indirectly supports kidney health because proper sleep helps the body detoxify and repair at night. Healthcare practitioners in Australia and Canada are increasingly adding rooibos to dietary programs designed for kidney protection, especially for those trying to lower creatinine levels and reduce pressure on the kidneys without using diuretics or harsh medications. For seniors who struggle with appetite, especially those with kidney disease-related fatigue, licorice root tea can offer additional support. It contains glycyrrhizin, a compound that supports adrenal health and indirectly improves kidney function by regulating cortisol levels and reducing stress-related inflammation. However, licorice tea should be used cautiously, especially in seniors with high blood pressure, as it can cause sodium retention and potassium loss if overused. In the United Kingdom and Canada, it's often used in rotation with other herbal teas to support elderly patients with chronic fatigue, hypotension, or kidney inflammation linked to adrenal insufficiency. Some older adults in the United States use deglycyrrhizinated licorice, DGL, to avoid the blood pressure effects while still getting the soothing benefits for the urinary tract. Seniors who once struggled with constant tiredness, lightheadedness, or mood swings due to hidden adrenal stress often report improved stamina and fewer kidney-related symptoms after incorporating small doses of licorice root tea under the guidance of a knowledgeable provider. In the United States, many elderly people have shared emotional stories about how their health declined gradually and silently until one day they were told their kidney function had dropped to 40% or less. That moment is terrifying. Many describe it as a type of emotional paralysis, not knowing what's next, whether dialysis will be part of their future, or how they'll afford the cost of care. In Canada, Seniors have spoken about how integrating herbal teas like nettle, dandelion, and cranberry into their daily lives made them feel like they had some control again. In Australia, elderly communities often gather weekly to prepare healing teas together, turning it into a social and supportive ritual. In the United Kingdom, where herbal medicine still holds cultural significance, many seniors are taught from a younger age to respect and use these natural tools before turning to prescription drugs. In contrast, the healthcare system in the United States has not prioritized natural prevention, leaving many seniors feeling overwhelmed and disconnected from their bodies. But it doesn't have to stay that way. The emotional pain, the fear, the confusion that comes with kidney decline, there are ways to ease it, to make it more manageable. Incorporating the right teas consistently and with care can reduce symptoms, support the kidney's filtration capacity, and improve the quality of life. Herbal teas are not a miracle, but they are medicine when used correctly, and they offer something deeper than just physical support. They offer comfort, autonomy, and a sense of action. And for seniors, navigating a confusing healthcare system surrounded by prescriptions and conflicting advice, that sense of action can mean everything.